Hi there, I hope you've enjoyed your journey with us so far. So, you've been diagnosed with acne, and this short video is going to help you better understand the treatment that you're going to be receiving. Now, first of all, if your acne is mild, you can start with just the cream medications alone, which can be in the form of skincare and the prescription acne creams, including retinoids. Now, if you have moderate or severe acne or cystic acne, you require combination treatment with oral medications. Now, this video will go through all of these treatment options thoroughly. The following are the skincare steps for our acne treatment protocol. First, cleansing. Request for the milk cleanser if you wear makeup for a double cleanse. Otherwise, the honey cleanser is sufficient. Second, prescription creams and spot pimple creams, followed by application of serums, which is everything in a glass bottle, your moisturizer, and finally, your sunscreen. The honey cleanser contains medical grade honey that helps to stabilize the skin microbiome, reduce redness and flaking, as well as balance sebum production. It contains Arnica montana, which has potent anti-inflammatory effects, especially for those with oily and dehydrated skin. After cleansing, you should apply the betamethasone lotion for the first 7 days according to your prescription. Every night you should be applying tretinoin. However, if you have dry, sensitive skin, this will not be prescribed to you. This should only be applied at night. Now, importantly, spot acne treatment is with the blemish spot cream. There are 2 ways which you must use this for best results. Apply it twice daily liberally over all the acne-prone areas for prevention of comedones, and also on the spots directly. If you have an active acne bump, you should be applying it liberally 5 times a day at minimum. It contains chlorella vulgaris, which has efficient oil control properties and can reduce inflammation so it will not progress to a cyst. Additionally, it helps to treat hyperpigmentation and scarring because it contains methionine and other amino acids. Now, we go on to serums. You will have received in your package glass bottles. The easiest way to identify serums is the fact that it's all packaged in these glass bottles because it blocks light from penetrating the ingredients and makes sure that the active ingredients remain stable. The 2 potent serums that will help you in acne treatment are vitamin C as well as the Elixir V serum. The Vita C serum contains nano-formulated sodium ascorbyl phosphate, a stable and neutral form of vitamin C that can reduce the scarring as well as provide an environment where the bacteria will not proliferate. It's suitable for sensitive skin. The Elixir V serum is provided in the form of a sampler for you to trial for the first 10 days. Should you require the full size, please inform the nurse. It contains Centella asiatica, transresveratrol, Lauricia, all of which help to control inflammation and lighten and prevent acne scars. The next step is the moisturizer. The radiance fluid is an emulsion, which means that it is oil in water, ensuring that it is effective in delivering niacinamide, coenzyme Q10, vitamin U, and peptides to your skin and control excess oil production, refine your pores, and heal your skin. Importantly, it is a lightweight mixture which is suitable acne sun protector. You may use other recommended brands such as Cetaphil, La Roche-Posay, which you may purchase from Guardian Pharmacy. The key with the DR.TWL Dermaceutical Sun Protector is that it is specifically formulated for those living in tropical Singapore. It is meant for Asian skin types, so it does not leave a white cast on the surface of your skin, which is a common issue with European or Western-based sunscreens. It has SPF 50 broad spectrum protection. It is essential protection for acne scars and contains additional portulaca oleracea or purslane extract for anti-inflammation, as well as hexapeptides, which help to heal your acne scars. This is very important because tretinoin increases your skin's sun sensitivity. You should apply sunscreen every 3 to 4 hours, even when you are indoors. If you are using the Kion's mask, you do not need to apply it over the cheeks because the Kion's mask has ultraviolet protective factor of 50. However, if you are outdoors, you should be applying the sunscreen over the forehead as well as other parts of your body which may be exposed. This is to prevent sunburn. It is very important because your acne scars can darken if you do not protect yourself from the sun. This is very important information for acne spots. Firstly, do not squeeze no matter what. If you find that the pimple is almost coming to the surface, you may use a cotton pad moistened with warm water after a warm shower to gently press around the area. The pus should be released easily. If not, please do not attempt to squeeze because this will cause increased secondary bacterial infection and scarring. What you should do instead is to apply the blemish spot cream 5 times a day to the acne spot, as well as the hydrocolloid patch. Now, it's important to note that the acne spot cream is slightly greasy as it is cream, so you should wait for it to be absorbed for at least 1 hour. Wipe off the residue with a moist cotton pad before applying the hydrocolloid patch. The hydrocolloid patch, worn overnight especially, can cause the residual debris to be released and the pus to be released as well. Finally, use the Kion's mask to prevent acne and secondary infection. The hydrocolloid patch is also very useful to prevent secondary bacterial infection. Now, if you have moderate to severe acne, cystic acne, or adult acne, especially hormonal acne, DR.TWL would have discussed with you the importance of incorporating the skincare regimen into an oral medication regimen. This is because moderate to severe acne does not respond well to just topical medicines alone, although the oral medicines given should only be given for a fixed period of time. The first line treatment generally includes oral antibiotics. So if you have been prescribed oral antibiotics, please take note that you should follow the schedule as per the prescription exactly. And also, if you are under the age of 21, you should get your guardian to supervise you to ensure that there is no mix-up of oral medications for the first 2 weeks of treatment. Now, when you're taking oral medication, it's important to look out for the following: development of any thick body rashes. Second, any side effects such as excessive diarrhea or heartburn. If you experience any of these side effects, please stop taking the medications and send us an email at the email address provided. For further review, if you have cystic acne, the first medication that may be recommended to you can be isotretinoin. Isotretinoin is a vitamin A derivative. It needs to be taken under strict medical monitoring for safety and effectiveness. It is dosed based according to your body weight, and we would have calculated the final total dose that is required for you. Some patients can take a shorter course depending on what is discussed. Importantly, you have to follow the skincare and lip care regimen when you start on isotretinoin because it can cause severe skin dryness as well as lip eczema. On top of that, there is a need to do your blood test regularly. The nurse will let you know the details of your scheduled blood tests.
Well, that's it for your first visit. We'll be seeing you in 10 to 14 days' time. If you develop worsening of your acne in this period of time, do not worry, as you may have heard of the term purging. Well, the regimen that we've designed is actually meant to stop most of these bad effects of purging and let you see immediate improvement, especially in the skin texture as well as the size of your pimples. However, if you are one of the few that develop more pimples, do not worry. Continue with the regimen and we'll see you in 10 days' time and we'll be able to update you as well.